I think we can go ahead and get started. Thank you for joining today's webinar, which is the fourth in the WHO Climate Change and Health Technical Webinar Series. My name is Kristiina Yang, and I work with the Climate Change and Health Unit at WHO headquarters. It's my pleasure to moderate the session today on an introduction to developing a Health National Adaptation Plan, or HNAP. This is a very key tool for advancing climate and health action at the country level. By the end of the session, you should be able to provide an overview of the HNAP process and have greater insight into the sequence of steps for developing an HNAP. And just before we start, I'll quickly cover some housekeeping. So firstly, we will be running this webinar twice today. This first session taking place now from 9:30 to 11 o'clock Central European Time, and one taking place later today at 3 o'clock to 4:30 p.m. Central European Time. The overall content will be the same in both sessions, so there's no need to attend the session later today if you're able to stay for the whole time today. We will be making the recording of both sessions available on the WHO website, alongside the recordings of all of the webinars in this series, which can be accessed at the link on the screen or via the QR code. Here you can also see the previous and forthcoming topics for the whole webinar series, and you can register for the forthcoming webinars at the same link. So some additional administrative items for today's session. Simultaneous interpretation is available in English, French, and Arabic for this session. To set this up, please find the interpretation button in Zoom and select the language that you would like to listen to the session in. We have set up this session as a meeting rather than a webinar in Zoom so that we can encourage more engagement and discussion. So you should be able to unmute yourself and share your video if you would like to. We do, however, ask that you please stay muted when you're not speaking, and we invite you to use the chat and Q&A functions throughout the session. And as mentioned, please be mindful that the session is being recorded to be shared on the WHO website in the coming days. For today's agenda, we will open with remarks from Diarmid Campbell-Lendrum, who leads the Climate Change and Health Unit at WHO. We'll then have a presentation from Dr. Amy Savage from the Climate Change and Health Unit at WHO to provide the introduction to HNAPs. We will then move on to two country experiences. So countries that have had recent experience developing HNAPs. The first will be from Dr. Munjed Al-Sharif, who's a consultant and team lead for the HNAP update of Jordan. Then we will move to Rajaram Pote Shrestha, who is a national professional officer in the WHO country office in Nepal. We will then move into breakout rooms for smaller group discussions about what you've learned on the HNAP, and we'll come back together for feedback from the groups and to close the webinar at the very end. And so with that, I'm pleased to pass the floor now to Diarmid for the opening remarks.
Thanks very much, Kristiina, and thanks to everybody who's joined today. It's a real pleasure to see so many people connected again. I'll keep my remarks very brief. I think that those of you who have joined us for the previous seminars will know that we place a really high importance on this webinar series. It's a comprehensive program that should take you through the things that you need to know effectively in order to set up and support and maintain a climate change and health program in your country. And this webinar, we say this about all of them, but this webinar is particularly important because we and others have spent years now, decades in some cases, telling people that they need to be concerned about health and climate change. They need to, do something about it. In one of the previous webinars in the series, we've talked to you about carrying out a vulnerability and adaptation assessment within your national context to see what your problems are, what are the adaptation options that you may have in order to respond to these problems. And the next question is, okay, but what are you actually going to do about it? What is your plan to protect people's health from climate change? And that's what HNAP's health components of national adaptation plans are all about. We've also, from WHO and others, have produced technical guidance on what should be done in order to effectively populate an adaptation plan, the actions that you can take. And I refer you particularly to our operational framework for building climate resilient and low carbon health systems. So that gives the map of what can be done. But in order to come up with a really comprehensive and effective plan, you need to go through the process of developing that plan. And there are better or worse ways to do it. And there is now some quite good experience from the country level in how to develop that plan. One of the things that we really want to emphasize is the national ownership, the local or the national ownership over that plan. Because particularly now that climate change, the awareness of climate change is becoming very high, including the connection between climate change and health. And because climate change connects to so many health issues, there's a potentially very wide scope of actions that need to be taken, and a wide range of partners who may want to work with countries in order to work on specific aspects of this issue. It may be a specific disease, might want to work on climate change and malaria, or climate change, natural disasters, and so on. We think it's really important that the country has their own plan that they have taken ownership of development of, and that it makes sense in their national context, so that they're in the position to say to external partners, yeah, we want you to help us with this, this, and this, but here's how we see the problem, and here's how we want to address it. And it's also very important that that plan connects to the overall national strategy of what the country wants to do about climate change as a whole, because health is very important, but the country will also be considering about what they're doing on food systems or natural disasters or water resources and so on. So the health part needs to make sense and connect to the rest of that context. So that's why we think this is important. And I'll hand back now to Amy to take you through the guidance that we have, the experience that we've gained. And for us, we particularly look forward to hearing as much from you as we're trying to tell you from WHO, because we're all in the learning process here. And as I've said a couple of times already, the country experience is paramount. So with that, thanks again for joining, and back over to Amy, I think.
Thanks so much, Diarmid. And just bear with me a moment while I share my screen. So today I will be taking you through an introduction to health national adaptation plans. So why they're important, what they are, and the process, the steps to develop a health national adaptation plan. And not just the plan itself, but also the process. We like to see health national adaptation plans more as a process than just a document, a plan that sits in someone's drawer after it's finished and doesn't get implemented. The implementation is obviously the key component, but all the planning in advance is also important to set up that implementation. So this presentation is part of a bigger module that we have on training for health national adaptation plans, and we will be covering a bit more of it in future webinars. But today I hope that after this session, you will be able to understand how health national adaptation plans contribute to the broader adaptation planning processes, be able to explain the HNAP process and sequence of steps for developing the HNAP. Now, we won't be looking in depth at quality criteria for a high quality health national adaptation plan today, but we do have a future webinar in a few weeks covering that. The same with the operational framework. We covered that in the last webinar that we did. So if you'd like to get a more in-depth overview of the operational framework, you can look at that recording, but we will refer to and mention the operational framework because it is a critical tool in developing the health national adaptation plan. And then I hope over the series of these webinars that you will be able to apply all this knowledge within the broader context of your health system. So this is just an overview of what we'll cover. We'll be sharing the slides at the end. I won't go through this in detail. I did want to talk about first where the HNAP fits in the overall process. So this is a visual representation that we developed of how WHO supports countries in building a climate resilient and sustainable health system. So first, of course, we need to understand what are the health risks, what are our greenhouse gas emissions in the health sector, and also what are the health co-benefits of different mitigation and adaptation actions, both in the health sector and outside the health sector. And then once we have a clear understanding of the situation, we then want to develop our plans. So climate change and health planning. And this includes the HNAP, of course, but also the NDCs, and we will have another webinar on the NDCs, the long-term low emissions development strategies and other plans, as well as integrating climate change into health planning. And then, as I mentioned, the HNAP is not just a plan, but also a process. So as part of the HNAP process and the overall process for building climate resilient and low carbon health systems, we need to finance these actions. We need to have funding to be able to implement. Then we need to implement the interventions and, of course, monitor our progress in the context of a changing climate. So we'll be touching on all of these aspects today and in the whole webinar series. So we'll start off just to get our brains moving a little bit, so we're not just listening to me speak. So we've set up a Slido, a very quick Slido. You can join at slido.com, put in the code #WHOCCH, or scan the QR code in the corner here. So just firstly thinking about what are some of the actions that you think are important for health adaptation to climate change. We'll just take a few moments to see some of the results and give you a moment to get onto the Slido. So I can see a few people are typing. So understanding the crisis. This is essential. We need to, well, there's the advocacy side, ensuring that decision makers understand that it is a crisis, and then understanding what that means in a specific context and how we can use that evidence to inform our planning. So the HNAP should be evidence-based. So we've got risk assessments, that's all related, VNA assessment, climate change, health facilities. We want to make sure our health facilities as part of the overall plan are resilient, low carbon. Stakeholder engagement, of course, that is crucial, and we'll be talking about that a lot in the first steps of developing an HNAP. Community engagement, so all the different stakeholders that should be involved. So I think we'll move on because we don't have a lot of time, but you can keep, I think you can keep contributing to the Slido. These are all really important actions for building climate resilience, health adaptation to climate change. So what is a Health National Adaptation Plan? Essentially, in a simple way, we define it as the health component of the National Adaptation Plan process. So the National Adaptation Plan process is a short and medium-term planning process to reduce vulnerability to climate change at a national level and to integrate adaptation into policies and programs. And it was a process established as part of the UNFCCC and the Paris Agreement. So the HNAP is really that health sector contribution to the National Adaptation Planning process. So there's a range of climate plans, and I mentioned some of them before, and some of them are mentioned here. The nationally determined contributions, long-term low emissions development strategies, and of course the National Adaptation Plan process. And the HNAP fits into the NAP process, but you can see from the arrows in this diagram that they're all interlinked and aligned. So we hope, for example, that the HNAP would fully align with what's in the adaptation chapter of the NDCs. And then on the left, you see the WHO operational framework for building climate resilient and low carbon health systems. And as I mentioned, this is a really critical tool for developing a Health National Adaptation Plan. It's a practical tool. And if we look at all the 10 components of the operational framework, and implement actions under those 10 components, we have a really good chance of having a climate resilient health system. So why develop a HNAP? Why are they important? Well, firstly, to ensure that the health sector is engaged in the overall NAP process, so that health is considered in national climate change planning processes. We also want to identify strategic goals for health resilience, and then the HNAP is really a guiding plan for the health sector and can be used for other health determining sectors to ensure that we do adapt the health sector to the risks of climate change. So we want to ensure that the health impacts of climate change are prioritized at all levels of planning, both in climate change processes and within the health sector. Link the health sector to the international and national climate change agendas and working with health determining sectors across the country. And then we can really use the Health National Adaptation Plan to improve the opportunities that we have to access climate financing and other financing for climate change and health. We probably all know that the health sector is one of the sectors that is the most underfunded when it comes to climate finance. The HNAPs are a really good tool for accessing climate financing because they benefit from national ownership, they're informed by a robust evidence base, they're endorsed by the UN, and they can be seen as the main plan for climate change and health resource mobilization for adaptation specifically. And the WHO does support countries to develop project proposals under the GCF, the GEF, the Adaptation Fund, using the HNAP as the guide. And just as a little bit of background and to understand a little bit more how health fits into the National Adaptation Plan, we did an assessment. It's a little bit outdated now. We are updating it this year, but we did this assessment in 2020 to understand the degree to which health was already included in national adaptation plans. So we included all 19 national adaptation plans that had at that time been submitted to the UNFCCC. We had a look at the context sections and the health chapters to assess the degree to which health was integrated in the national adaptation plans. And the key findings from this review, we found that all of the national adaptation plans identified health as a priority sector for climate change adaptation. And they all considered a range of climate sensitive health risks. But we did find that there were gaps between those climate sensitive health risks that were identified in the NAPs and then the actions that were included in the plans to really address those risks. So there was a gap, and I'll show you a graph of that in a moment. Many of the national adaptation plans did also address several components of building a climate resilient health system. So in our HNAP, we want to consider addressing specific climate sensitive health risks. So for example, we want to consider addressing vector-borne diseases, waterborne diseases, whatever is found in the VNA to be the most important within a specific country. But then we also want to ensure that more broadly, we are building the climate resilience and the adaptive capacity of the health system, which will then cover a wide range of climate sensitive health risks. And most of the NAPs identified actions in other sectors that will have benefits for health. So out of the climate sensitive health risks, just briefly, we did find that the most commonly identified climate sensitive diseases were vector-borne and waterborne diseases. But as I mentioned, there was a gap between the identification of these health risks and any specific actions to address them. So for example, in this graph, we can see that all of the NAPs identified vector-borne diseases and waterborne diseases as a clear climate sensitive health risk, but only say 60 to 70% of them included specific actions to address this risk. And you can see even bigger gaps in some other areas like malnutrition and foodborne diseases. And as I mentioned, many of the NAPs did address several components to build a climate resilient health system. So looking at the health system more broadly and comprehensively, we can see that there were many actions in the NAPs, or many of the NAPs included actions around the health workforce, around climate-informed health surveillance and early warning systems. And then there were some areas that were less addressed, such as management of environmental determinants of health or financing. So what are the features of an HNAP? An HNAP is based on the best available evidence. Usually that would be a climate change and health vulnerability and adaptation assessment, but considering a wide range of other information, studies, it ensures that the health sector is embedded within the NAP process, that the health sector is engaged in the national climate change planning processes. The HNAP integrates climate change adaptation also within the health sector into health planning, strategies, processes, and monitoring systems. And as Diarmid mentioned, crucially, it is a nationally led process owned by countries. So we'll provide a set of steps, but it's a high-level set of steps, and it needs to be modified and adapted to the local context based on the VNA, based on the local capacity assessment. And as such, it is a flexible tool to address climate change, and it can be applicable to multiple settings and contexts. So here I'll just quickly mention the 4 steps and then go into each of them in a little bit more detail. And just to note again, we do have a publication on quality criteria to give some suggestions for how to ensure that your health national adaptation plan is of a high quality, is comprehensive, but we'll look at those in a later webinar. You can see them on the right here in this slide though. And we published a guidance, I think it was around 2015, that shows these steps to developing a health national adaptation plan. There's 4 steps with 11 sub-steps, and they're based on the steps of the guidance of the UNFCCC that they published on developing a national adaptation plan. So it's entirely aligned with the national adaptation plan process in that sense. And the first step is to lay the groundwork and address the gaps. And then there's some preparatory elements, developing the evidence base, looking at the health sector and developing a plan. And then we want to implement the plan. And as part of implementing the plan, develop an action plan, a very detailed plan for the implementation of the adaptation actions that we've prioritized. And of course, we need to monitor, review, and report on our health national adaptation plan. So I think I've mentioned it before, if not, the HNAP really is an iterative process. We develop a plan, but we need to continually review and check that the plan is working, that it's effective in terms of increasing resilience and improving adaptive capacity, but also that it's still relevant for the changing context. So we'll start with the first step of laying the groundwork and addressing the gaps. As mentioned, the HNAP is part of the broader national adaptation plan process. So initially, we need to set up the institutional arrangements that will allow the health sector to be fully engaged in the national adaptation plan process. We want the Ministry of Health to be part of the coordination mechanisms at national level and ensuring that health is considered across the board, across the sectors, when the National Adaptation Plan is being developed. And then the Health National Adaptation Plan is the health sector contribution to the overall NAP. We want to assess at this stage, at the beginning, what is the already existing evidence that we can use to inform our HNAP, and are there any gaps? And then identifying the links between our national development priorities and health adaptation strategies. So here, I'm presenting here some institutional arrangements that are very generic. It's an idea of what some arrangements could look like, but this would change from country to country, context to context. For example, we have seen in some countries where the health sector is a little bit ahead of the National Adaptation Plan process, and they've moved ahead and developed their HNAP before the National Adaptation Plan process has even started. In other contexts, perhaps the National Adaptation Plan is already developed and the health sector contributes to that. And then ideally, perhaps they would happen concurrently. But either way, the key is that the health sector is fully engaged in the overall process, which is usually led by the Ministry of Environment or the Ministry of Climate Change, but then with the Ministry of Health as a key actor, stakeholder in the National Adaptation Plan process, while coordinating with the other sectors, which also, of course, influence health. And then at the same time, the Ministry of Health has a role to ensure that the HNAP is institutionalized and mainstreamed within the health sector, within the different health sector operational areas and programs. So a brief case study from Nepal, and you'll actually be hearing, as you know, from Rajaram in a moment on much more detail. But it's a very good example of the institutional arrangements that were set up to support the Health National Adaptation Plan. So the Ministry of Health in Nepal led the development of the Health National Adaptation Plan and really recognized this importance of the health sector engagement in the National Adaptation Plan process. There was active consultation with the Ministry of Environment and other stakeholders. And in Nepal, a dedicated unit was created within the Ministry of Health to manage the overall coordination of the implementation of the HNAP and its integration into the National Adaptation Plan. And this strong leadership of the Ministry of Health really enabled the development of the HNAP and the prioritization of climate change and health at the national level. So that was step A. Step B, now that we understand what evidence is out there and we have identified any gaps, we see if we need to build that evidence base. So if a climate change and health vulnerability and adaptation assessment has not yet been conducted, it would be recommended to be conducted at this stage so that we can inform the development of the HNAP with the understanding at a country level, even at a subnational level, what are the specific health risks in our context? Develop the national strategy on health adaptation to climate change, and then we need to develop a plan of action and looking at all the possible range of adaptation actions, so using the operational framework and coming up with the potential adaptation actions to address all the risks that we've identified within the evidence base to consider including within our Health National Adaptation Plan. So as I mentioned, we can use the operational framework as a practical tool to structure our HNAP, to understand in what areas we could consider adaptation actions to address all the health risks that we've identified within our context. And these are just some examples, and they're very broad examples, and the specific interventions in different countries will vary. But for example, we might want to include some adaptation actions on capacity building on climate change and health for the health workforce, establishing a climate-informed health surveillance and early warning system. We might want to look at our healthcare facilities and ensure that they're climate resilient and sustainable, develop climate resilient water and sanitation safety plans. And all these actions are quite high level. So under each of these, there will be more specific actions. We'll need to develop an action plan that has specific timeframes, specific responsibilities, and each of the actions underneath these overall interventions. So we will identify a range of adaptation actions, but of course, the HNAP is for a specific period, and it won't be possible to, it's unlikely to be possible to implement all the adaptation actions that we would like to in our second iteration of the HNAP. So we need to prioritize the actions. Some of the key considerations for prioritizing adaptation actions would be to look at what is the current morbidity and mortality of that specific climate sensitive health risk, for example, malaria, dengue, diarrheal diseases. What are the projections of the future health impacts? What's the magnitude of those health risks in the future, considering the specific climate hazards for our context? And then also, when we're prioritizing, considering what are the effectiveness of the current policies and programs in managing the risk. I won't go through all of this, but obviously when we're prioritizing, there's a lot of things to consider. We need to consider technical feasibility, operational feasibility. Will these interventions or actions, how effective will they be? Environmental acceptability, economic efficiency, social and legal acceptability. And there are several approaches to prioritization. These are outlined in a lot more detail in the vulnerability and adaptation assessment guidance, but it will be up to each country to decide, considering their context, considering their capacity, their resources, how they would like to prioritize their adaptation actions. So for an example, in Grenada, they conducted a prioritization exercise with a range of experts in the country. They first categorized all the adaptation actions that they'd identified into the 6 building blocks of the health system. And here we can just see 2 of the building blocks with some actions underneath. And then for them, the criteria that they wanted to prioritize on was priority, and that would be that would encompass a range of different considerations. What are the priorities of the health sector, and affordability? So with expert judgment, they used a simple point system and gave points to each of the adaptation actions. And that was how they prioritized for this current iteration of their HNAP. What were the adaptation actions that were feasible to take forward? So once we've identified a range of adaptation actions and we've prioritized those considering a range of criteria, we want to implement the actions. So first we want to develop an implementation strategy and plan to operationalize our Health National Adaptation Plan. And we would recommend that that is quite detailed. As I mentioned before, what is the time frame? Who is responsible? What are the actions that need to be undertaken to achieve that overall adaptation intervention? And again, this needs to be coordinated with ideally coordinated with the National Adaptation Plan process, national development priorities, and other health determining sectors, so that we can ensure that we promote synergies, health co-benefits, and increase the success of the implementation of the HNAP. And we need to mobilize financial resources because, as we all know, we need lots of financial resources to implement adaptation actions. So an example from the Republic of Montenegro, they established a national working group with representatives from various health institutions. And in their HNAP, they had a very strong emphasis on adequate allocation of human and financial resources. So they identified a range of institutional barriers, but aimed to ensure that there were the resources there to overcome those barriers. And as such, as part of their Health National Adaptation Plan, they included a resource mobilization plan for both human resources and financial resources to drive implementation. So I mentioned before that health is one of the sectors that is the least well-funded in the climate change space. And we found in our last global survey on climate change and health that insufficient finance was the main barrier to implementation of the HNAP. 70% of the countries that responded to that question identified insufficient finance as their primary barrier. So it's important as part of the HNAP to estimate what the resources are. Financial resources, yes, also human resources, to understand what is needed for implementation. And then using the HNAP to access external funding sources, which will be a necessity for many countries where domestic funds are not sufficient to implement the entire Health National Adaptation Plan. So that external funding sources like the GCF, the GEF, the Adaptation Fund can fill some of those funding gaps. And the HNAP can be used as a platform or as the main plan for accessing funding from donors and external funding sources. So the final step is, of course, as we mentioned, reporting, monitoring, and review. So part of this may be strengthening health monitoring systems for health vulnerability and health systems resilience. For example, establishing an integrated surveillance and early warning system. We also want to understand, well, one, is the HNAP being implemented? But also, are the actions that we're implementing, are they effective? Are we increasing resilience? Are we addressing those health risks of climate change? We would aim also to integrate monitoring across the sectors, so including health indicators in other sectors and including climate indicators within the health sector. And of course, as mentioned, it's crucial to iteratively update the HNAP. HNAPs are usually for a period of 5 to 10 years. Ideally, we coordinate with the NAP process and update the HNAP when the NAP is being updated. Of course, there's different factors and different contexts that will decide when the HNAP is updated. When it's updated, hopefully we will also update the vulnerability and adaptation assessment so we have an updated understanding of what the health risks are in a specific context, because climate change is unstable and different aspects of a context are unstable. So we want to continually assess, are we doing the right thing to increase resilience? So that's all from me today, and I'll hand back over to Kristiina.
Thank you so much, Amy, for that fantastic overview. Just to mention, we're a bit short on time today for Q&A, so please feel free to add any questions or comments to the chat or the Q&A function in Zoom, and our team, including Amy, will try to respond. We had some country experiences, but we're now able to hear from 2 countries, from Jordan and Nepal, about their experiences developing HNAPs. So it's now my pleasure to invite Dr. Munjed Al-Sharif to present on the HNAP experience of Jordan. Over to you, Dr. Sharif, and please feel free to share your slides. Thank you.
Thank you very much, and good morning, everyone. As mentioned earlier, my name is Munjed Al-Sharif. I'm working at the German Jordanian University in the Civil and Environmental Engineering Department, and I'm leading the process of updating Jordan climate change and health adaptation strategy and action plan. Just for your information, I mean, it was mentioned earlier that some countries actually had their own HNAP before the National Climate Change and National Adaptation Plan, and Jordan is one of them. Jordan actually had its first HNAP in 2012, and it was part of the Millennium Development Goal Fund joint program administered by many UN agencies. One of them, of course, was WHO, and these are the components that were done during that HNAP. Just a quick summary of that. HNAP will be coming later. Just for your information, Jordan also has just released its fourth national communication, and there was a major focus on health issues, which is a little bit better than it was before in the third national communication. And just for your information, Jordan is now embarking on carrying out the fifth national communication, and the issue of health will be very much focused, even better than the fourth national communication. Of course, these are the typical kind of most visible impact of climate change on health in Jordan, as reported by the fourth national communication, and I don't think you will see kind of strange input of this communication, where we are reporting increase in waterborne and foodborne diseases, increased in vector-borne diseases risks, reduced access to nutritious food, increase in spectrum of disorders, and increase in outdoors worker exposure in solar ultraviolet radiation. We carried out extensive workshops and meetings, around 6 of them. And the outcome of these professionals and stakeholder meetings, maybe I forgot to mention that the Ministry of Health was basically kind of coordinating and leading the process. We had the cooperation of the Ministry of Health on this regard. And I'm referring to the ownership point that was mentioned by Amy at the beginning. And we also recognize the importance of this. And we were in full coordination with the Ministry of Health and, of course, supervision with the WHO. The outcome of those meetings were basically they agreed on the duration of the strategy, let's call it, or the action plan, which is 10 years. And they wanted to be a focus on short-term intervention, especially for the first 5 years. Although also we visited the 2012 to decide on the most important projects that were developed over there. It's worth to mention that in the 2012 HNAP, there were 24 projects selected and recommended by that action plan. Unfortunately, only 2 of them were reported. And of course, I would say that some of the constraints were related to financial issues, once again, as reported by Amy a while ago. Of course, you could say also about the Syrian refugee crisis, because in Jordan we had a major flux of Syrian refugee crisis. And of course, you can add on top of that the COVID-19, where actually a lot of the government focus was on COVID-19 in the last 3 years. Of course, we agreed on adding a mental health outcome for the new update. And also we agreed on the importance of the One Health approach. And also it was agreed during those meetings that to use the findings of the 4th National Communication, since it is the latest information document that we have in issues related to climate change and health. Of course, the strategy actually will be developed for the national level, but of course, we will try to get the information on the district and sub-district level. And this is the major component of the action plan, which is, as it was, I'm sure you all know this, the climate change and health vulnerability adaptation assessment planning. We have the capacity assessment, health outcome vulnerability assessment on adaptation. And if you notice, we added also on top of the 6 mentioned in the first one, the mental health. And we also developed the adaptation measures and project program for each health outcome. This is kind of the typical design that we are doing. Of course, design and assess is our focus. Evaluation will be later done after the implementation of the program. And this is the methodology we have used. I will not be going through it since because of the short time, but I think it's very much consistent with what was mentioned earlier by Amy. Just for your information, we had a lot of issues related to data and data challenges, and we try to overcome this by obtaining the data from different resources. That it's not only with the Ministry of Health. We use the Department of Statistics. We even try to get the information from the 4th National Communication and other people working in the area. And basically, I would say that data is a challenge. And I think if you are embarking on carrying out a new or an update of your strategy or action plan for health action plan or HNAP, you will have to be sure that data will be available. And also you have to kind of compensate for the gap of data in your analysis. One major finding of the HNAP exercise, it was agreed by all parties that a climate-based early warning system for health outcomes are there, because I'm not sure if you kind of went through this before, but it was very difficult to relate incidence of diseases directly with the climate change parameters. So okay, you have an increase in temperature, you have a decrease in precipitation, but how do you link it to kind of the diseases that might be stemming out of that? That was a major thing, or a major difficulty, and this is why we had to kind of agree on coming with a climate-based early warning system for health outcome. And of course, we have to use the information that we might need for the system. And as you notice from my slide over here, we basically need epidemiological data, socioeconomical data, and meteorological data to support this early warning system. And this is a kind of a schematic of kind of our early warning system protocol that we will implement with the 4 categories of data that you see to your left, with the socioeconomics, meteorological, epidemiological, and entomological data. And of course, you see at the center of the stage is the surveillance system, where we also agreed with the parties, with all parties, that surveillance system will have to be created to be robust and to be strong, so that we can support the early warning system program. Thank you very much.
Thank you very much for the presentation. We will move straight to the presentation of Raja Ram, Pote Shrestha from the WHO Nepal Country Office, to talk about the HNAP development experience of Nepal. But if you have questions for Dr. Al-Sharif, please do feel free to use the chat and the Q&A function. Raja Ram, over to you.
Good morning and good afternoon. First of all, I would like to thank WHO headquarter team for giving us opportunity to share our country experience on developing a national adaptation plan. Here I will briefly talk about the process that we followed during the development of the health national adaptation plan.
Oh, Raja Ram, sorry to interrupt.
Can you see all?
No, we can't see the slides yet.
Can you see now?
Yes, perfect.
Okay, thank you. Many of you know that Nepal is a landlocked country between India and China, with approximately 147 square kilometer and population of about 2.9 million. We have 3 distinct ecological regions, namely mountain, hill, and Tarai, with just above 60 meters above from the sea level, up to the Mount Everest, which is the highest peak of the world, with 8,848 meters. The meteorological data that we have shows that all 3 regions have been highly affected by global warming, despite our very negligible contribution to the global greenhouse gas emission. We can see that the rainfall pattern has been significantly changed over the years, but the total participation is almost the same. However, we notice that there is an increase every temperature, not only in the summer, but also in the winter time as well. We also have been talking about limiting global temperature at 1.5 degrees centigrade, which is hard to meet. And recently published ICMOD report shows that the Himalaya is warming at 0.3 to 0.7 degrees Celsius faster than the global average due to the elevation-dependent warming. And because of this, the Nepalese delegation that has been attending the ongoing Bonn conference has rightly warned that 1.5 degrees is too hot for Nepal. And accordingly, we have to very seriously think about this issue. I'll try to give one example from Nepal it is about the melting of snow. This is picture of the Mount Everest, which was taken in 1921. And another picture is also from the same area, but taken in the 2007. And we can see from these pictures that over 86 years, there's a significant decrease after this snow. And because of this, the General Secretary of the UN, Guterres, during his visit just before this COP28, rightly mentioned that we have to take seriously climate action to stop this activity. So there are several impacts of the climate change we have been facing at the country level, and there are wide coverage in the media. Especially they are about depletion of water sources, increased climate-induced disasters, effects on this biodiversity, also the prevalence of the vector diseases in the mountain regions. We have the media coverage. We also have some scientific research studies that WHO supported the government of Nepal to conduct this kind of studies and disseminated the findings. And in recent years, we have seen the very significant increase of the dengue cases. The first case was detected in 2004. In 2 decades, it was just around 100 numbers. But since last year, the numbers are about 50,000 in each year. So it also shows that the impacts of the climate change on health is very serious. And the global threat for the health system is the climate change that has been globally recognized actually through to the Nepal as well. Realizing this issue, the political leadership has reflected health impacts of the climate change in several policy documents. So we can mention a few of them, like this National Adaptation Program of Action. It was developed in 2010, and even that period the health was considered. Then we have this climate change policy revised in 2019, and also we have this National Adaptation Plan. And also in the National Health Policy and National Health Sector Strategic Plan, the health issues related with the climate change have been very reflected. And together with this, there are some global commitments that the country made at a global level. For example, this is the Sierra Mala Declaration in 2017. Also, the Nepal made a commitment at the COP26 and also at the COP28 and approved this declaration on the climate change and health. In order to materialize these commitments and this issue, Nepal started conducting vulnerability and adaptation assessment even in 2015. And based on that, Nepal is one of the first countries in this Southeast Asia region that developed health national adaptation plan based on this VA assessment report. Then we have this COP26 and where the Nepal also made health commitments. And we all know that it consists of the 3 key areas. And one of them is about this updating of the vulnerability adaptation assessment and updating of health national adaptation assessment. So in line with these commitments, Nepal completed vulnerability adaptation assessment in 2022, and the findings have been used to update the health national adaptation plan that is recently approved by the government of Nepal. While developing health national adaptation plan, as mentioned by Amy, we follow the steps and the guidance developed by the UNFCCC and the WHO. So we started with reviewing the policy documents, stock taking of the information, and conducted the vulnerability adaptation assessment. And we also formed this we developed institutional arrangement within the health sector to develop this health national adaptation plan. So now with a good coordination with the different stakeholders, updated health national adaptation plan is in place. It will be reviewed and it will be updated on a regular basis later on. So when we talk about the integration between the Ministry of the Environment, which is the lead agency on the climate change, and the Ministry of the Health, we think that we consider that it's a good collaboration. As you mentioned that the Ministry of the Forest and Environment recently developed National Adaptation Plan, and with health as one of the key thematic areas. It identified 7 programs, 34 objectives under the health theme, and in order to provide this technical health related inputs to the National Adaptation Plan, there is the thematic working group under the Ministry of Health and Population. And good to note that the National Adaptation Plans also provisions development of the sectoral policies and programs. And accordingly, we consider that Health National Adaptation Plan is not separate, and it is an integrated part of this overall NAP. As we also mentioned, like in Jordan, and also as Amy mentioned, we developed Health National Adaptation Plan before the National Adaptation Plan. Health National Adaptation Plan was first developed in Nepal in 2017. Then we had this National Adaptation Plan in 2021, and now in 2024 we have updated Health National Adaptation Plan. For development and for the implementation of this Health National Adaptation Plan, there is a high-level steering committee under the chairmanship of the Secretary of the Ministry of Health and Population for the overall policy guidance. And for the technical inputs and for the overall technical supervision, there is a technical working group under the Health Policy Division within the Health Ministry. Here are some photos. We started having the collaboration with the Ministry of the Forest and Environment with organizing this joint workshop. Then we have this insertion workshop. We have the meeting after this technical working group on the regular basis, and we also have this right workshop, and that was supervised by the steering committee and each program. So when we see that this updated Health National Adaptation Plan, it has 5 strategic objectives related with advocacy, capacity building, integrated disease surveillance, with linking with this climatic information, and organization of the capacity building and advocacy at the federal, provincial, and the local level, and also this multi-sector collaboration. It is a costed plan. It has the allocated responsibility for the different institutions within the health sector, and also this is beyond the health sector. And this document has been developed with the technical and financial support from the WHO. While developing Health National Adaptations, we had several learnings. The first one is this evidence-based, because the HNAP is, we all know that is the technical document. And because of this, that we started with carrying out this VA assessment, and this technical findings will have been used for this development of the HNAP. And that is also useful for the effective implementation of the HNAP and integration of the climate risk in the regular health program. And the other thing is it should be in line with the policy documents and the commitments that the Ministry of Health made at different levels. And we also know that health and climate change are the cross-cutting issues. So there are people and agencies working on the air quality, nutrition, mental health, disaster, and there should be a good collaboration. And we ensure through different technical arrangements to have this kind of the good engagement, technical inputs from them, so that we have this good document, and it will be very easier for us to implement with collaboration in future as well. At the same time, we also realize that it should be very realistic. We have limited technical capacities as well as financial resources, and considering these two things, it is although costed, but we definitely considered the allocation from the national government, as well as we also considered opportunity for accessing the global climate mechanism, financing mechanism. So in this way, we have this Health National Adaptation Plan. We have the lessons and experience from the developing the first Health National Adaptation Plan, and we also used this experience to update this next updated Health National Adaptation Plan. Thank you at this moment, and I'm happy to answer any question or comments if any. Thank you. Over to you.
Thank you so much, Rajaram and Dr. Sharif, for the presentations, bringing forward some practical examples of carrying out the HNAP process. We will be moving directly into the breakout rooms for further discussion. So I will pass over to my colleague Amy to quickly explain the topics.
Thanks, Kristiina. Just sharing my screen. So you've probably heard enough talking and presentations for now. So we're going to move into breakout rooms so that we can have a chance to have a little bit of a discussion. And we want to think about, well, we want to hear about what are your experiences with developing and implementing a health national adaptation plan. So what challenges or barriers have you faced? And if you haven't been involved in a health national adaptation plan process, or you're just embarking on one, what are some of the challenges or barriers that you think you might face? How have you or would you overcome these? And what do you think are some of the critical factors that enable or drive forward the development of a health national adaptation plan, and particularly its implementation? So we'll be discussing all these questions. We'll use Jamboard, but we'll have a facilitator in each room and they'll be able to explain those technical details. So back to you, Kristiina, on how the breakout rooms will work.
Great, thank you, Amy. So in a moment, you'll be invited to join a randomly assigned breakout room. All the rooms, as Amy mentioned, will be discussing the same topic. If you require interpretation in French or Arabic, do not join the breakout room. Just click the Not Now button when you're receive the invitation. This is because interpretation is only available in the main room. But if you accidentally join a breakout room and you do require interpretation, you will be able to return to the main room where interpretation will be available. And then just as a reminder to the interpretation team, please press Not Now when the button comes up, and I will open all of the rooms right now. We should have all the groups back now, I hope. Thank you all for participating in that very quick breakout session. I'll pass over now to Amy to conduct the reporting back. Amy, over to you.
Thanks, Kristiina. So we only have 5 minutes to the end of the webinar, so we're going to be super quick, but we would love to hear back from the other groups. I know in my group we had quite an active discussion, but the Jamboard as well had lots of interesting points. So let's start with the main room, and I understand that Ronald Nebamara will be reporting back. I ask you to really keep it to 30 seconds to a minute so we can get through all 4 rooms and then close the webinar on time. So Ronald, if you would like to go ahead.
No worries, and thanks, Amy, for that. So just to facilitate what transpired in our room, Orena, are you able to project our notes in case?
I can project very quickly now. Feel free to summarize and I'll project.
Yeah, and so straight to what transpired in the discussion. One is that we realized that there was limited finances to facilitate the development of teams that are working on the HNAP. And 2, we see very low levels of completion, HNAP completion rates in some countries. We also see our ministries and stakeholders having limited capacity to really coordinate multi-sectoral engagement because they come from the background where ministries are struggling for resources and working alone, and therefore, finally, and yet we have some, as ministers, talking about integration, we have to look at what is happening in other sectors that we work with and that impact on the health sector, climate and the health systems, and then be able to integrate well and develop a very feasible HNAP. So, and that we thought that WHO would be a good partner to really coordinate government entities to come together and develop that. We also see stakeholders in the health sector, especially having limited knowledge on what has been happening in the climate space. And as climate becomes another big lion that we have to fight in the health system, we see stakeholders coming with limited information on climate, but struggling to really develop HNAPs which have to really have very clear integration of climate and health. So there is need to really first orient the actors in the health sector on what climate adaptation, mitigation, and etc. is, so that they can support feasible development of the HNAP. And so if I may wrap up, that was it. And colleagues, feel free to come in and supplement. Thanks, over.
Thanks so much. That was really interesting and really good points. I'll move straight to the next group. So Jelly Molino, who is in breakout room 1. Would you like to go ahead?
Yes, thank you, please. Can we ask Ichi to share? So we have a very active group. Imagine in a very limited time, these ideas come up. But at any rate, for purposes of summary, what we have noticed, in my case, I have no experience developing HNAP, so I was just looking at all of these ideas that are being shared. And one thing I've noticed insofar as the challenges are concerned, it actually focuses on these 3 key aspects in developing a HNAP, which is in a leadership and enabling environment, which is really very crucial if you look at the samples that they have provided. Also, that an HNAP is not really an assessment that should focus only on the health, because it involves cross-sectoral coordination. So this should not be done by only one ministry. It has to be cascaded with different key stakeholders. And of course, just like with the first group, resourcing is very, very crucial. So if you see that some of the challenges are really focused on financial, but at any rate, there are a lot of the orange part focuses on what have they have done in overcoming similar challenges, and you see that there's a really need to come up with policies that are promoting the HNAP, and there has to be some funding that are supportive in making sure that this will be done. And one thing good about the group is that the green focuses also on the enablers. So it means that yes, there might be challenges and a lot has been done. Experiences have been shared in the previous discussion on Jordan and Nepal. And the environment is really there. There are enabling factors that we can really take advantage of in making sure that we will be able to develop HNAP. So this is such a great exercise, and thank you for the opportunity to participate and learn.
Thanks so much, Jelly. That was really interesting, and so much interaction and input in your group. So we'll move on to Mike Wiggins, who will summarize for the group that I was in. Thanks, Mike. Maybe Mike has had to drop off because we've already hit time. In that case, let's just move straight to Janito, and maybe if we have time, I'll do a quick summary afterwards. Janito from Group 3.
Okay, I'll try my best to speed. I think most of it has been already been said. So in our group, we've been developing. Can you hear me?
I was not unable to unmute. I'm now. I can do.
Okay, Mike, maybe let's just go with Janito because he's sharing screen, and then we'll come back to you. Thanks.
Yeah, can you hear me?
Yes, we can. Thanks, Janito.
Yeah, so I thought, as I in our group, we discussed that in developing an HNAP, we face key barriers like securing stakeholder buy-in, incentivizing sectoral collaboration, and also addressing data gaps. So misalignment with governance structures and dependence on external donors further complicates progress of implementation of HNAP. So to overcome these challenges, we propose the creation of dedicated technical working groups, aligning HNAP with broader adaptation priorities, and also involving all governance level from the local to the central government. So documenting resource needs and integrating HNAP into national policies are crucial, along with regular updates of the VNA assessments. So political leadership and multi-sectoral collaboration and also clear data sharing policies are vital for successful HNAP development and influence. So yeah, in a nutshell, this is what I captured from our group. Over.
Thanks so much, Janito. So over to Mike.
Apologies, it wouldn't let me unmute earlier. So very strong alignment with what everyone else has said. I suppose to point out clearly that wealthier countries have stronger public health institutions, so they have a much stronger internal capacity to lead this process for themselves. For countries with less money, they have to rely on consultants, and while consultants might be able to do the work very well technically, there is a big challenge of Ministry of Health engagement, leadership, and building their capacity. And there is a political economy kind of challenge, and this collaboration between government departments is a challenge. And a key way forward to address that is one, persistence, two, to have an insider, such as a former employee, a retired person from the department who has the relationships and has the word trust came up quite a lot. But there's an importance to make sure that a strong team is built. We need the WHO country desk, we need the donor as well, to be kind of seeing what's going on and championing great relationships, great communication, capacity building. There's the same challenges others have: financial constraints, paucity of data, the need to find data, proxy data from other sources where we have to. I think I'll stop there.
Thanks so much, Mike. That was great. So I won't take too much time to summarize. I think there's a lot of crossover between the groups. There's some familiar challenges and some solutions, having a champion, having strong political will, good awareness of climate change in the health sector and across the sectors on climate change and health, ensuring the capacity is there and working with local consultants where possible to promote national ownership, country ownership and buy-in, ensuring data sharing. And I'll leave it at that for now because there was a lot more that the others summarized much better than I just did. So I'm going to hand over to Kristiina because we're already a little over time so that we can close. Thanks so much for your attention today. Thanks for your input into the breakout groups. They were really interesting, and we will share the Jamboards with the recording.
Perfect. Thanks, Amy, and everyone. Yeah, just to reiterate, our thanks to all the presenters and speakers and yourselves for the contributions to the session. We hope you found it to be insightful and inspirational no matter what stage your country is in the HNAP development process. As a reminder, we have a number of other webinars coming up, which you can see on the screen. The next one is next week on the 19th of June. We will also save the presentation recording and Jamboard responses at the link. And then just to end, we have one more Slido question, which is which part of the HNAP process would you like to learn more about? So if you have any reflections on that, we'll leave the Slido open so you can continue responding even after we close the Zoom. We also welcome any feedback or questions on the webinar or any future sessions that you would like to see from WHO. So this feedback here would be very helpful. And yeah, thank you so much again for your participation. And we look forward to seeing you again in a future webinar soon.